Welcome to the Four Eyes podcast, brought to you by YoungOD Connect. We give you a clear view into the new grad optometry world across Canada and the US. We are your hosts. I'm Dr. Deepan Kaur.
And I'm Dr. Amrit Bilkhu. Dr. Ioussifova, thank you again so much for being on our podcast today. And for our listeners who don't know who you are yet, would you mind telling us a little bit more about yourself?
Sure. Well, thank you so much for having me. I'm excited to be here and chat all things eyeballs and nutrition and anything else we want to talk about.
Yeah.
But I am a practicing optometrist in Portland, Oregon. I graduated from the New England College of Optometry in 2007 and did a residency in Boston in the Community Health Center. Which was a wonderful experience. I got to see everything in that setting. And then I moved back to Oregon, which is where my family lives, in 2009. And I actually worked as an adjunct faculty, clinical faculty for Pacific University for almost 10 years.
Wow.
And then while I practiced for a few years it was an optical, but like a private, not a chain, optical that was optician owned. So I kind of was a independent contractor did that for a few years, and pretty much, it was a perfect setting because it got me really thinking about opening my own practice and what kind of things I wanted to do. So I opened my practice in 2013. So we just celebrated our 10-year anniversary.
Yeah, congratulations.
Thank you. Yeah, it was a cold start. Any cold start, as you know, very, very difficult in the beginning. But I'm happy kind of to say now I only work 2 days a week. I used to work 7 days a week.
Yep.
Pretty much, even if you're not seeing patients, you're there doing everything else. But now at a point where I only see dry eye patients, and I work 2 days, Mondays and Tuesdays, and on Fridays I do autologous serum or PRP preparations and things like that. But yeah, that's kind of my practice in a nutshell. We've been doing advanced dry eye treatments from pretty much from day one. As soon as I opened the practice, I saw that there's real need and demand for really addressing dry eye at the high level and advanced treatment options. So I invested into all these advanced treatments early on. I mean, pretty much right away I got LipiFlow, IPL got like 5 or 6 years ago, and started doing everything as soon as I really felt like, okay, I could financially do it.
Yeah.
And then with the nutrition thing really came organically after that too. So having the time, because I'm in clinic 2.5 days, that really gave me a lot of free time, and kind of quote unquote free time, because
it's never free time.
It's really never free time.
Yeah.
But gave me some time, some freedom to really go back to school and study nutrition at the master's, at the graduate level, and really be able to apply it not only to my dry eye patients, but really that was the motivation for my dry eye patients, but really across all, I discuss nutrition with everyone, basically. Everyone I share.
That is amazing. I mean, your journey sounds very unique, but also, I mean, quite similar to probably a lot of optometrists out there. You've kind of dabbled into different, modes of optometry. And congratulations, first of all, on that 10 years of private practice. So that's amazing.
I'm actually you.
Thank you. Yeah. So now I'm starting to, I understand. No, free time is not free time. Free time is admin time. I've learned very quickly. But just a side question that's not related to the functional medicine, just because for your dry eye practice, you started about 10 years ago, correct?
Yes.
So have you seen that exponential interest in dry eyes from patients? it must be so different for your practice now compared to in the beginning.
Yeah, I think the difference now is dry eye, really even 10 years ago, it was prevalent. It was more prevalent.
Mhm.
Most doctors, most optometrists, ophthalmologists were not really paying as much attention to it.
Yeah.
What I was frustrated with was that I was just not okay just telling patients to do warm compresses, artificial
Yeah.
tears, and take fish oil, and then they would come back and be like, it's not better. And I was like, I
Yeah.
don't know what else. Oh, I guess we'll try Restasis. And for me, I was like, well, let me see what else is out there. And then, like Lipoflow was already out for some time. We had Miboflow, like some of the early
Mhm.
MGD treatments. IPL was just getting started. So I was like one of the first ones to get it. And
Wow.
it was kind of like, one of those things people were like, what is that? Like it was a lot of now, like patients when they come in, that's the difference. To answer your question is a lot of my patients now are educated on dry eye.
Yeah.
So they come in, they know what IPL is.
Mhm.
When I even say IPL, they're like, oh yeah, I read about that. Oh, I know about that. So I think the information, the patients were there, but just the treatment information wasn't as prevalent or
Mhm.
as readily available. As now, it's like the discussion is much easier.
Yeah.
Um, Again, by the time patients are in my chair, they've already seen multiple doctors, they've already
Yeah.
done research. So again, they are very educated on
Mhm.
dry eye. So, which
Awesome.
is why I want to have all the tools, I want to have all the answers. I want to know, if they're coming in with something, I don't want to be like, what's that? So it's like, what's next?
That's a perfect question because when you ask yourself in the dry eye world, what's next? I mean, this whole episode is all about another area of healthcare where you can try to tackle dry eye disease, and that's with functional medicine, right? So I love that you wanted to expand your knowledge and expand your treatment options, for your dry eye disease patients, by educating yourself on functional medicine. I think it's awesome. And can you tell us more about just generally what functional medicine is and how functional medicine relates to ocular health in general and dry eye disease?
Yeah, so functional medicine is kind of, looking at a patient or a person from like addressing a problem comprehensively. So
Mhm.
it's not just here's a disease, let's just, uh, prescribe a medication or do a kind of a reactive approach to that problem. It's looking at a whole person from every angle and looking at it like systemically.
Mhm.
So in functional medicine, it's the root cause that they look for. So they're not looking for why is this organ not functioning. It's looking at, okay, what kind of systems that could be affecting this organ. So root cause is basically is it, and it's a lot of times it's obviously nutrition, wellness, and the approach is preventative. So right, because if we know that a root cause of one problem is something in the gut health, it's not just going to stop with that organ, it's going to affect other organs and things like that.
Mhm.
So that's why what I love about it, and again, going back to dry eye, we know is multifactorial, right? We know that there's a lot of factors, and now with the new DEWS, the lifestyle report, we know, they talk about the gut microbiome, they talk about the sleep, the role of
Mhm.
sleep, like it's we've known that stress and anxiety, or our patients with dry eye have a higher risk for those conditions. With they have depression,
Yeah.
anxiety, they have autoimmune conditions.
Yeah.
So this is why I basically, like few years ago now, in 2019, I decided to go back to school to study nutrition, and it's human nutrition and functional medicine. It's a naturopathic school, but they have basically masters in nutrition, and they have other like chiropractic school and things like that. Essentially, I mean, when I was going through it, I was like, oh my gosh, what am I doing? I'm literally back
Yeah.
at school, like taking exams and studying
Yeah.
for reports. I mean, every week we had to read like a scientific paper and do a report on it. It
Yeah.
was a lot of work,
Wow.
I'm so thankful for that, because again, it really, I mean, the whole world of nutrition and functional medicine is just like, I mean, I'm just scratching the surface of it. I
Yeah.
feel like I've studied it at the really deep level, but I still feel like there's so much more to learn.
Mm-hmm.
Um, and I wish that in school we had some sort of, something about nutrition and wellness, because
Yeah.
yes, and this is not just in our area, in just even in medicine, healthcare providers, doctors, physicians, nobody's really taught nutrition. And it's a shame, because
Yeah, that's true,
for
actually.
every
Yeah.
physician, every doctor should really have a good knowledge of nutrition, should really have the time to discuss that with patients.
Mm-hmm.
I mean, I can't tell you how many times I've heard this from my patients, that they're like, wow, you're the first doctor to tell me about this. I mean,
Yeah.
rosacea is a perfect example. Rosacea, we know, is a really high risk factor for MGD, right?
Mm-hmm.
If you have ocular rosacea, you have MGD. If you have facial rosacea, most likely you have ocular rosacea, therefore MGD. Now with IPL, we know like the importance of addressing the inflammation on the lids, but gut problems are so prevalent in these rosacea
Yeah.
patients. So when I talk about this, when I'm like, do you have these symptoms, bloating? Do you get constipated easily? Do you have some pain in your stomach after certain foods? Do you get flushing after eating this food and this food? And they're like, yeah, I didn't know, those that was actually related, or that would exacerbate my skin, or that would cause all these problems on my skin. So again, making that connection between what you eat, your rosacea flares up, therefore your dry eye flares up. That's the connection. And so many times patients tell me they've never heard that before. They've seen
Yeah.
a dermatologist for many, many years. They've never talked about food and how that could be the cause. So a lot of times, again, they're prescribed doxycycline or some topical
Yeah.
treatment to put a band-aid on it, which works temporarily. As we know, with chronic use of antibiotics, we now are disrupting the microbiome even further. So then it's like this vicious cycle these
Yeah.
patients are in. So they'll kind of have a no problems for a little bit, but then they'll have a flare up again. And they're like, what
Mm-hmm.
happened? That's kind of what functional medicine does, is that like, you're not just putting a band-aid on the problem. Let's get to the root cause of it. Is this
Yes.
something going on with your gut health? Do you have dysbiosis, that imbalance of your gut microbes? Gut problems like dysbiosis has been linked to anxiety, depression, and even like some other dementia and
Yes.
Alzheimer's.
Yeah. It's so funny that you mentioned that. Yeah. No healthcare provider other than a nutritionist is learning about nutrition. And, I guess on one end of the spectrum, you would think, okay, well, like you said, there is so much, there's a whole universe about nutrition that, you could learn about. So is that too much information for maybe all healthcare providers to learn? Maybe. But yeah, I mean, we don't even get simple courses on nutrition. And when you really think about it, macular degeneration is the one of the number one retinal diseases where we learn green leafy vegetables are important. And then that's it. And then they just kind of go on to the next topic and say, well, this injection works and this, and sun protection. And then when you sit with your patients, you kind of say, yeah, eat some green leafy vegetables. And then they're like, what ones? And I go, oh gosh, I don't know. Let's go to the grocery store and look for something dark green. I don't know. And so not only for things like macular degeneration, dry eye is all inflammatory, right? I mean, there's so many inflammatory components to dry eye. So
Yeah.
why are we not learning about anti-inflammatory foods, anti-inflammatory ingredients? We should
Yeah.
be learning about those things. And I'm on the same page as you, which is why I love this conversation. As a BV doc, the eyes are part of the whole body and the nervous system. So I can see how mental health really
Yeah.
influences your functional vision and the way your eyes work as a team together, or if they don't. I don't understand nutrition yet. but I totally feel the energy and the enthusiasm of what you're talking about so far.
Yeah.
Yeah.
Well, this is, and maybe this is a good way to kind of talk about the programs that Dr.
Mhm.
Celia and I have come up with. So Dr. Celia Futch is an optometrist, and she is also a CNS, a nutritionist, a certified
Nice.
nutrition specialist. So we actually met to, in this program that we were doing.
Oh,
to
wow.
be, so that's where we met. And then all of our cases, or majority of them, were really dry eye patients. So after we finished this program, we were like, why don't we put together an online program, our protocols together? I mean, this is something that we know works. We've worked with, again, so many patients one-on-one, but instead of doing one-on-one work, let's put it together where we can get the program out to more people, to more
Mhm.
patients. So that
Yeah.
way, like you said, if it's a practitioner, an optometrist who is aware of, like, okay, there is something going on here where I want you to work on your nutrition, and want you to maybe follow a certain protocol, but they don't know where to go. That's what this program is for. So it's a program for
Yes.
patients only, and it's basically very much structured 10-week program. This one is different because it's specific for dry eye,
Yeah.
created by optometrists / nutritionists. So we have specific supplements, we have specific foods, we have specific, protocols, or
Yeah.
recipes. We have food
Yeah.
recipes. The nice thing, what's really unique about it is that we have also live sessions with Celia and I. So that's a lot of programs out there are kind of like you just kind of do it yourself, and
Yeah.
so this one, first of all, you have a forum of other participants or people, patients going through it. So it's kind of a community, right? So you have a community of,
Yeah.
in the forums you can post questions and things like that. So it's kind of like
Wow.
same people, or people,
Yeah.
going through the same thing. And then we also have live sessions with me and Celia. They get access to two doctors who are also nutritionists. So that way they
Yeah.
can ask questions about supplements, foods, or eye health and things like that.
Mhm.
This is a collaboration with referring doctors. So we make it clear that we can, like, change their treatment plan, if they're
Mhm.
put on Xiidra, Sequel, whatever. We're not going to be changing things. We're here to kind of put things together to answer their questions
Yeah.
and things like that, but we're not necessarily taking over their eye doctor.
Mhm.
So it's a partnership with the eye doctors. We want to be supportive to what they already do, but it's not replacing their eye doctor. And
Wow,
that's
that's
and that's
amazing.
another thing. Like, we had a lot of requests from eye doctors, our colleagues, on, hey, I wanna learn more about this nutrition and how to talk to my patients. So that kind of was because of the demand, how much how many people were asking us, is this for doctors? Because I want to take it, I want to learn this. That gave us an idea. So we put together a master class, a gut health master
Yes.
class, and this is for eye doctors only. And this is basically like a lot of really amazing content on everything you want to know on gut health and auto imbalances and things like that, and how to basically to give you the knowledge and tools to be able to recognize if somebody has certain symptoms, so you feel
Yeah.
comfortable talking to them about, oh, I think you might have IBS, or I
Mhm.
think you might have, again, you don't need to diagnose it, you don't need to treat it,
Mhm.
but at least know how to recognize and have the discussion and have the conversation. And that will give you, again, the power to sort of, you feel comfortable talking about these things,
Yeah.
and how to, like, have that discussion
Yeah.
with your patients.
It's like taking that one extra step for the patient, right? It's exactly what you mentioned earlier. You said that, you ask patients a question about their gut health when they're in the eye exam, and the patient goes, "No one's ever really asked me that before." If you ask a patient a question that takes that extra step in the exam room, you're always going to blow the patient away. They're always going to think, "Wow, this is the only doctor who's ever taken the time to dig in a little bit more Even if you
Yeah.
didn't solve the problem, you didn't make the official diagnosis, you maybe couldn't even offer them other treatment plans, but you were the one who showed, I really do care. And I'm going to try to ask a few more things, try to dig in a little bit more. When it comes to dry eye disease, like you said, it's so important too, because yeah, their mental health can be affected significantly. So if you can identify those patients where they've tried all their dry eye treatment options and they're still not happy, they're not satisfied, they're suffering, nutrition is definitely an important aspect that if it hasn't been touched or discussed yet,
Yeah.
this sort of a program is wonderful. I
Yes.
love the program. I thought it was a great idea. Does the OD have to refer them for the program, or does anyone have access to the program just if they randomly Google this program online?
Correct. Yes.
Mhm.
So we have, it's on online, which our new website is ithrivewellness.com. So EYE thrivewellness.com. And that's where you can find both of these programs. But so it's out there. So if we promote it, people can find us on their own. But we also wanted to make it like a, kind of a affiliated thing for referring doctors. But yeah, I mean, that's the thing. I feel like we have so many other ideas now that we're like, okay, this is doing well. Let's see what
Mhm.
else. Like, is there demand for another conditions? Maybe for
Yeah.
D, right? So
Yeah.
macular degeneration, for glaucoma, because so I think it's gonna be the whole personalized nutrition is the way to go, obviously,
Yes.
because every disease has different imbalances and
Yeah.
every person is different. So even within the dry eye, like just your dry eye is different than my dry eye. So knowing the root cause, and that's kind of, I don't have a cookie cutter approach. Like when colleagues reach out to me and they're like, what's your protocol for dry eye? I'm like, it's very
Yeah.
personalized.
It's different.
I have to like really know the person, like look at their full history, look at their lifestyle, look at, and then I tailor my approach specific for that patient, whether
Mhm.
it's my, in-office treatments or pharmaceuticals or biologics and,
Yeah.
like nutrition and wellness, all of that is very much personalized. And I feel like that's how every medical approach treatment should be.
I am
Yeah.
100% on board with you. Even how you're explaining how you handle dry eye disease is exactly the way that a lot of us, and especially myself, approach BV issues. There is no cookie cutter solution for CI or accommodative excess or, an intermittent exotropia that only shows sometimes and then doesn't show up the other times. You don't just slap on the same amount of plus, minus, or prism for every similar disease and say, okay, well, this should work. Everyone's different. They have different mental health status. They have a different personality. They have different reactions. They have different comfort zones. They have different refractive error. I mean, there's so many different things, and you really do have to see the person as a whole to say,
Yeah.
okay, I have a general toolbox. Now let's start picking which one we're going to try based on the 10 minutes that I've kind of assessed you, just even from your behaviors. Now I
Right.
already know kind of what you need. So I love that. If we're an optometrist who is treating dry eye disease, we have dry eye patients, but we don't know a lot about nutrition. Yes, your program is available, which I think is awesome, and I think everyone interested should try it. But what are the other resources for connecting patients to those resources? If we
Yeah.
don't have them available in our office.
Yeah, I think that's a great question. So I think first it starts by bringing awareness, right? So like we talked about, talking about, okay, so there's something more going on than your eyes. There's something,
Mhm.
it sounds like there's, especially if these patients have autoimmune conditions. And maybe starting out by just asking, hey, what's your diet like? And a lot of times your patients will say, oh, it's fine, oh, it's good. And then you'll say, well, what did you have for breakfast? Oh, I just had a bowl of cereal, you know. So like,
Mhm.
so
Yeah.
right there, if you get specific, you'll get some very specific answers. And it blows my mind that people, this is still a thing. Like I had a patient actually just like last week, a diabetic patient who said he just has a muffin and coffee every single morning. That's his morning, breakfast.
Yeah.
Right there, like if you just get specific, like what exactly do you eat? What did you have for lunch? What did you have for dinner? What's your typical dinner? And then you can really, from that, just making it common, like, hey, how about instead of a muffin, have some like protein in the morning, and
Mm-hmm.
have an egg, have something that's not processed, that's not just added sugar,
Yeah.
something, just even simple suggestions, which are very, common sense for us. Like, you don't have to be nutritionist to be able to say, and let's
Yeah.
swap that with add a green smoothie in the morning to kind of load
Mm-hmm.
it up with lots of nutrients, and give some, maybe a general recommendation on smoothie recommendations. So you can kind of do a little bit of that yourself, right? But let's say
Mm-hmm.
that you don't have the time, you don't really want to do it, or you don't, necessarily feel comfortable doing it. Sometimes, so there's actually a resource, it's called ifm.org, the Institute of Functional Medicine. And I use that a lot, that for my patients, to find functional medicine doctors.
Nice.
So let's say they have like Sjogren's, or like, even diabetes, like metabolic disease. And I ask them, like, is your rheumatologist or endocrinologist or your primary care doctor, are they helping you, or are they telling you what kind of foods to eat? And they'll say, no, nobody really like has done that. I'm like, are you interested in that? Oh yes, of course. I'm like, okay, this, again, if I feel like I'm not the right person to really dive really deep with them,
Mm-hmm.
I would refer them, or recommend this website where they can actually put their zip code, and then and pulls out all the functional medicine doctors in their area.
Oh,
And these are,
awesome.
again, that are medical doctors. Some of them are naturopathic doctors or PAs. I mean, you can be an OD and be on this group. So again, it basically, anybody who is taking the time after their traditional,
Yeah.
medical training, to do more functional medicine, clinical work. So then again, these are the great doctors to pair up your patient with, because then, yes, they can take the time to do some functional testing to see what kind of help they can do. Or
Awesome.
yeah, so I think, that's the resources there. And but as I want to also, this is why we came up with this masterclass too,
Yeah.
because I want to help my colleagues to
Yes.
feel comfortable getting the conversation going. Because again, a lot of times, as you know, like, our patients really trust us. I have
Yeah.
patients who say, I don't want to do that, I don't want to work with anyone else, I want to work with you. So that's kind
Yeah.
of why this is why I actually went back to school to be a nutritionist, because I was like, well, I don't know what I'm doing. I want to
Yeah.
I want if I'm going to help you with this, I need to know what the heck I'm
Yeah.
talking about.
I
So
think it motivates you too to help them more when you see how much they appreciate you, right?
yes,
When those
yeah,
patients
yeah,
appreciate you, you want to go above and beyond to help
yeah.
those patients.
These dry
Yeah.
eye patients are, yeah, they are loyal. They like trust me more than they trust their primary care doctors. They're asking me for advice on everything. I feel like I'm their, mental health
Yeah.
doctor. I'm their,
We
I'm their,
are. I think
yeah,
optometrists really are not like eye doctors first. I feel like we're eye doctors last,
yeah,
honestly. We're addressing mental health issues in the room all the time,
yeah,
nutrition, everything,
everything.
stress levels. We're
Yeah.
talking about everything with these patients. And then the eyes are like, oh, yeah, by the way,
By the
you
way,
also
yes,
have this eye
which is,
problem.
I think it's so great though. I feel
Yeah.
like I love that. I love being that provider for my patients, which is again what's keeps pushing me to do more
Yeah.
and to invest in myself, because if they're looking up to me for answers, or if they are coming to me for help, again, if I'm not gonna do anything outside of my scope. I'm gonna,
Yeah.
if it's really something that they need professional mental health, help, I will refer them. I will
Yeah.
make sure. But again, a lot of times, just even talking about stress management, right? In dry eye, again, that's something is, yes, nutrition, overall wellness, but stress management is so huge.
Yeah.
And, stress levels are high,
Yeah.
like really taking the time to talk about that. Like, hey, this is actually can affect your eyes. And
Mm-hmm.
patients are like, what? I didn't, yeah, my life is a mess. Like, I feel like everything is really, so
Mm-hmm.
taking the time to actually, again, bring awareness. You don't have to be an expert in that. You don't have to be like, do anything that you're not feel comfortable doing, but at least make the connection. And that's really
Yeah.
like, if we can do that for our patients, and then it's like a light bulb goes off. They're like, okay, I need to take care of that better. I
Yeah.
need to do that. Like, because now like my eyes are killing me because
Yeah.
I'm sleep. Oh, I didn't know it's because I'm not sleeping, or because I'm like, really stressed. Yet my work is stressful, and I come home and I'm, binging on, whatever. Like they
Yeah.
just like seeing the pattern,
Yeah.
and like, okay, as this is the result of that pattern, my behavior.
We as optometrists may think that something is so obvious. Patients do not know a lot of that information. So you have to remind patients and educate them on these little things that you may think
Yeah.
everyone knows,
And then,
but people really
giving,
don't. Just like
yeah,
the diabetic patient
yeah.
eating a muffin every morning.
Yeah, I think it's something, this area, the functional medicine, the root cause,
Mm-hmm.
um, approach, and nutrition and wellness. It's just growing in medicine in general, in eye care. So this is a great time to, get involved and get educated at any level. Again, you don't have to go back to school and do what we
Yeah.
did, but that's why we have the master class too, to kind of educate yourself. There's so many resources now to learn about this, so that way, again, we can make those connections. I mean, I get comments from my patients all the time that say, oh my gosh, like when I came to you for my eyes, and now my skin looks better, my eyes feel
Yeah.
great, my skin looks better, I'm sleeping better, my energy is better, my gut health is better. Like I get these, comments all the time from my patients, and that's what I want other
Yeah.
doctors, other optometrists to experience, to kind of get, to offer to their patients too, just so that, again, they're not just fixing one problem, because dry eye is usually has so many other,
Yeah.
comorbidities, other conditions that are present, that maybe are, we don't want to look at it as just like a separate problem. This is part of the bigger problem.
Yeah.
And you kind of put the, connect the dots. It's like, wow, effect, not
Yeah.
just, for like the results that you see in your patients, but patients come back to you, and they're like, that's why these patients are so loyal, and they're like, I want you to
Yeah.
ask me things that I'm like, I don't know, that's not my expertise, I don't know
Yeah.
anything about that.
They're trying to show you like, the
Yeah.
marks on their back. Like, can you fix this too? And like, can you just fix my feet and my hip is
I know.
hurting? And you're
I'm
like,
like,
no,
okay.
I can't learn more. Not right now. Not right now.
I have it even like a crazier story. Like I had this was like probably like 2 years ago now, a younger patient, and this just blows my mind. This story is crazy because she herself is a physician. She was a resident cardiology resident, and she had ulcerative colitis, and she had chronic dry eye. She was already on
Yeah.
immunomodulator, but she has, so, of course I talked to her about diet. I'm like, obviously you have a gut problem. And she was like, yeah, she kind of dismissed me. She was like, not really, she was like, okay, I'm a doctor, I know what I'm doing, type of thing.
Yeah.
So, but her diet, she was a very busy resident. She was eating like granola bars in the mornings, and
Yeah.
eating like hospital food for lunch and things like that. And a year later, she came back, and her eyes were like horrible flared up, and she was like, oh my gosh, my colitis was really, it was flared up 6 months ago. I've been on high dose prednisone for a long time. And she went to the Mayo Clinic to see GI specialists there, and she asked them about diet, and they said there is no specific diet
Yeah.
for ulcerative colitis. This is a doctor who should know better, and she went to the best clinic, the Mayo Clinic, and she was told, really, there's no specific diet for this. Literally, your colon is inflamed.
Yeah. Oh my
And you're telling
goodness.
me there's nothing, she should change her diet. And then she asked them if she can see a nutritionist, and they said they didn't have a nutritionist on staff, or available or something like that. I just couldn't, if I
Yeah.
hadn't, if I did not hear the story with my own ears, I would think that this is
Yeah.
not real. Because,
Yeah.
again, this was recent, only like probably a couple of years ago, and highly educated person. It's one of the best clinics we have for a GI special, problem that this, and she's told, no, that you don't really need to change your diet or do anything different. Just,
Yeah.
so it's like everything, yeah, it's like you're just suppressing the inflammation with a steroid.
Yeah.
You're not fixing
You're not
what's
solving the
caused.
problem.
Yeah, I mean, of course, she's, resident, high stress, poor diet, poor sleep, all like it's a recipe
It
for
all is combined.
but
Yeah.
it's like at least one thing you could do,
Yeah.
things that you're putting in your body that's going through your colon. So if you're not fixing, or if you're not doing anything different there, of course, I mean, her eyes were
It'll
the
never
least
get
problem,
better.
super inflamed, again, she was, but just a perfect example of like, there's a problem in our healthcare, right? There's
Yeah.
a big problem
Yeah.
between what the knowledge is there. I don't know, like it doesn't have to be completely, I feel like medicine, like the Western medicine, Eastern medicine
Yes.
is so different, right? Like
Yes.
it's like
Yeah.
I like to be, I'm in the middle, right? I like to
Yeah.
use,
Yeah.
yes, when I need my pharmaceuticals, they're great. I need them
They're
too,
great.
right?
Yeah.
Right? They're needed for this acute problems. But when you have a chronic problem, when you have something that's chronically inflamed, no, you have to use like
Yeah.
nutrition, wellness, like lifestyle. I'm not against medications, because when it's
When you
needed,
need
they're
it, you need it.
exactly. But I'm just also not gonna throw a doxycycline at you because
Yeah.
you have rosacea. Let's fix, let's figure out what's causing your rosacea. Let's do
Yeah.
IPL, let's do other things, because doxycycline is gonna disrupt your
Yeah.
microbiome. So it's like, again, my approach is like, yeah, evidence-based approach, right? At first, I, even with my nutrition approaches, I like to I tell patients, here's the evidence, or here's
Mm-hmm.
and we have a lot of it. That's the thing. It's like, I feel like, unfortunately, conventional MDs, conventional, traditional kind of training is like, they really dismiss a lot of nutrition evidence. But there's so much. Again, when I was in school, I was blown away. I didn't know. I was like,
Yeah.
wow, there's like this whole world, the whole science of nutrition I was not aware of. I'm just like scratching the surface, learning so much.
Mm-hmm.
And there's studies after studies after studies on all these things that, again, I didn't even know. And I feel like, again, when we're trained in the Western medicine
Mm-hmm.
training, we don't learn about that. We just kind of learn about very much like
Yes.
medication. Here's the evidence
It's
for medication. That's it.
the Western world. Oh my goodness. We're going to just like go right off topic on this. I feel like the listeners are going to be like, they're just ranting on and on about the Western world. But because again, I specialize in BV, and a lot of vision therapy is not accepted by, Western medicine doctors, and they don't believe in therapy. It doesn't exist. It doesn't work. It's hippie. It's voodoo magic, because the research and the articles and the case studies and the science that's out there is not presented in that perfect little box that the Western world wants to see. And that's not fair. That is not fair at all. We have vision therapy books and articles that were written almost 100 years ago that still apply to patient cases today. And it's so relevant and it's so real, because you see it in your chair, right, Mila? You see it in your chair every day. But the Western world wants a pretty little box wrapped up with a nice bow, in the box that they provide you, with the ribbon that they give you, in the size that they give you. And they say, put it in this. And ours doesn't fit.
Yeah.
That's what it is. It's so true.
It's very true. But I think it's changing, again, with the whole, like, I feel like there's definitely been a shift in how these chronic conditions and imbalances, like you see it with the binocular dysfunctions, you see, and even like in medicine, right? I feel like there is that shift towards the functional medicine, integrative medicine type of approach. So I think that, I don't know, I feel like in the next, 5-10 years, 20 years for sure, like it's gonna be this conversation is not gonna be like, oh,
A
why is this
controversial topic.
I feel like it won't be. Yeah, I don't
No,
know.
it
I mean, I
won't.
don't know.
It
Maybe,
won't.
yeah, I feel like it's just gonna, it is something that already accepted. And I don't know, not to get, yeah, I feel like it's easy to get
We could
into
talk about this all night,
all
honestly.
night, just go off
All
and be
night.
like example after example. But yeah, maybe we'll just not.
Yeah.
But yeah, I think it's exciting. So I'm excited to, it's almost like a new chapter in my career,
Mhm.
right? It's I've been practicing for 15, 16 years.
Wow.
And it's like first you're as a new grad, you sort of like try to figure out where you want to work. Again, I worked at Pacific University as an adjunct, and like while I was doing another thing. But so that was like a early phase, but then you have your private practice for 10 years. And I feel like that's on autopilot. It
Yeah.
keeps growing because I keep doing more things within
Yeah.
it. And then the next thing is like, okay, now I'm excited about this whole like nutrition and wellness, because again, we're in our profession because we want to help people, right?
Yeah.
And this is another way I can help people, not just with their eyes or dry eye. I can help them feel better. And
Yeah.
that's get feedback from my patients. That's when I'm excited, like, okay, I want to do more. I want to do more of this. And I want
That's
to
awesome.
reach out to more people to do this. And yeah, it's like, I mean, optometry it's one of the best professions I feel like to be in, because like it's giving me all this freedom and all
Yeah.
this like opportunity
Yeah.
to do different things and do different kind of like patient care. Yeah, so it's exciting. I want to
Awesome.
see like where the next 10 years takes me with this new kind of, not pivot, but new, like almost like a branch of optometry that I
Yeah,
do.
it's definitely a branch, but it's an exciting one.
Yeah.
I can already see it in your face. That's why, like, it's something you're passionate about. Yeah, I'm excited to see where you guys take the program in the future.
Yeah, I think no, it's I love patient care. That's
Mhm.
another thing, especially since I only do it 2 days a week, and that gives me, I miss it. Like if I don't,
Yeah.
I don't think I could just not do patient
Yeah.
care. That's one of the things that I hear from others about getting burnt out, and like that's, I wish I could talk to everyone when just about things that I've done, so that not that like, oh, this is the only thing to do, but I feel like you have to learn to do different things where you give yourself freedom, right?
Yeah.
Not to do the same thing every single day, because I feel like that's where you get
That's
bored.
the
That's
burnout.
out. Yeah.
That's the burnout.
So doing different things, having a specialty that you're passionate about, and doing other things that are maybe even outside of optometry, like, again, nutrition, and whether it applies to optometry or doesn't. But that, I mean, optometry is one of the best professions. So when I hear people that they say, they're already ready to quit and they're super burnt out, and that makes me sad, because I feel like there's so much opportunity to do great and to be very
Yeah.
comfortable. And
Yeah.
yeah.
There's a lot of branches that we can pick and choose. There's a lot of branches that we can add to the optometry trunk. And so, yeah, I love where you're taking functional medicine in with dry eye disease. And then I'm looking forward to how you're going to apply it to all other sort of ocular health conditions. And with that, yeah, I'll let you go, Mila. Thank you again for coming on. And I look forward to seeing you in person, hopefully at the next academy meeting or just next
Yes,
optometry meeting in general.
I'll be at the academy meeting.
Thanks everyone for listening to Four Eyes, the podcast series brought to you by YoungOD Connect. Be sure to subscribe and follow us on Instagram or YouTube at Four Eyes Optom for more content. We'll see you next time. Bye.